I think you should start at a very early age. I mean, you're not gonna move out at 5 years old, but I think you should be thinking about your future no matter how old you are.
With my health care, I think it was hard. I went through a couple of years where I didn't really do a lot because I never had really done a lot. Other people were not making me do things, but just like your mother makes you breakfast in the morning. Well, it was sort of other people influencing my behavior. And then I went through a period of no one was influencing me, so I didn't really do as much.
The toughest challenge, especially my first year of college, was that my parents weren't telling me when I had to do everything and helping me out with that, and I basically had my own choices to make, whether I wanted to take care of myself or not. And unfortunately, my first year, I didn't make all of the right choices, and I'm still suffering because of that. But it's basically, it takes time to learn the responsibility and everything.
It's different when you don't have your parents speaking for you, like making your appointments and things like that. It's very different when you have to take on that role by yourself. It's a very different transition when you're not used to doing it and you have to ultimately start doing it yourself. It's very different and very scary at some times in your life.
Yeah, I was encouraged to do things for myself at an early age and am now, and so that I think that will help me along in the future as well. And I was always asked the most serious or direct questions about my health were asked directly to me, and they valued what I had to say about it. I remember initially calling the pharmacy to refill prescriptions. I remember her just giving me the bottle and saying to call this number and go in and refill it. It wasn't that big of a deal to me, and then I rode my bike down to the corner and got it filled. They say it was big steps for them to let me do it. I'd never really looked at it that way. It was more like, I can do it, Mom, so why don't you just let me do it?
About the age of 15 here lately, I've been doing it on my own. My dad's dropped me off there, and I've been just talking to my doctors, just myself, and doing what I need to do, what appointments I need, and doing it on my own.
And through camp, too, being around other people with diabetes, I think I learned how easy it was, and then I got to the point where I liked it. I liked figuring out what was going on, and I liked figuring out what was affecting what and how to make it work. And I also got to a point where I realized you really do feel better if you're in better control. And I think that's something you just kind of have to learn. And the more I learned, the more control I wanted to be in. So as I got older, the more I learned about what tests needed to be done and what they meant and that kind of stuff, the more I wanted a doctor who was going to do that.
Prior to age 16, my parents were heavily involved in terms of my medical decision making. My doctors would talk to them and confer with them about any ideas that they had for surgeries for me, and I kind of just went along with that because, doctors know best, right? Then I'd say about when I was 16, the doctors started talking to me. And I'm not saying my parents weren't part of that process, they definitely were. But it was good to know that they were talking to me and explaining to me exactly what they were thinking. And then by the time I was 18, it was more or less all up to me.
A lot of times when you're in the room with your parents and the doctor, you want to ask the doctor stuff, but you don't want to ask the doctor stuff in front of your parents. And then I guess it creates more stress because you want to ask the question, but you're afraid of your parents' reaction or your guardian's reaction. But I see that as you get older, it's better for you to talk to the doctor because you know how you really feel.
Dr. Gardner, at my most recent physical, definitely expressed extreme satisfaction with the fact that I was going there by myself, the fact that I was branching away from my parents. And he felt freer asking me more personal questions. Going
from high school to living on my own, I think the The things that were difficult were things like finding a doctor or just learning how to do things on my own, you know, getting my prescriptions, things like that. But I think anybody goes through that, from going, you know, living on their own to, from living at home to living on their own. I think you just have some more things that you have to figure out. And the big deal is that it's important.
The biggest transition from high school to college for me was having to take complete responsibility for my health. Of course, you know, there were the small things like having to pay my own bills and wake myself up every morning and completely having to structure my own life how I wanted it, and not having my parents, you know, guiding me and holding my hand the whole way.
Once you start and somebody is there to teach you what to do, how to do it, then you get the idea of, you know, what to do.
I'd say that there aren't too many differences between myself and the average person. The average person has things that they have to take care of that no one else does. For instance, if somebody has a child at a young age, and you know they've got to take care of that child as well, and in addition to taking care of their own life. Well, I kind of have a part-time job as somebody else might with a child, or a full-time job as the case may be, in taking care of my body, and so I might have to take an extra half hour before I go out with friends to make sure I get my treatments done.
Well, because I have cystic fibrosis, my mom and I had to do a lot of extra planning. We had to find a cystic fibrosis center on campus at the college that I wanted to attend. And we also wanted to find a college that was in warmer weather because I found that I was getting sicker and sicker in New York. And I also wanted to find a college that provided the major that I wanted to study, which is rehab counseling. And the only thing I was really distressed about was leaving my pediatrician, who I had had since birth.
You know, I'm really kind of partial to my pediatricians.
I'm very nervous about changing doctors. I've had the same doctor since I was 11 for my diabetes, so you know, 10 years is a long time. But I know it has to be done.
My mom also taught me how to interact with these professionals in telling them what I need and what I want, because I'm the one who knows me the best and how my body works, and also how they can help me.
Well, then I went off to college, and that's when I sort of had to decide for myself and choose for myself. So I went through a period of pretty much trial and error and trying to find someone that I really liked.
I've been to plenty of doctors that are unfamiliar with my disability, but I'm the kind of person that I give everybody a chance. And if they're willing to listen, I'm willing to tell them about my problem and how they can help me overcome some of the difficulties I have in daily life.
When you go from your pediatrician to an adult doctor, you have to care for yourself more. The responsibility lays more on you, and I think they expect you to do everything. I think a pediatrician expects to do a little bit themselves, and even expects parents or other people to have a lot more impact than they do. And an adult healthcare provider you're the one that's in charge and that they're dealing with.
I turned 21, I feel like, you know, that's my responsibility. That's, you know, I've taken that under myself, and yeah, it's fine with me.
I think I like the fact that it's my responsibility, and I see that as freedom.
It makes it that much more rewarding to know that I did it, and basically it makes me a lot stronger to know that, you know, I'm capable of doing these things.
Good health to me means I can live a long and happy life and fulfill all my dreams that I want to fulfill, and maybe a few more.